Hello, my name is Kim Nguyen. I am a graduate of Penn State Harrisburg School of Nursing. I currently work as a registered nurse in the Harrisburg Hospital ICU. I've been working there for over a year now. My personal and professional experiences have definitely prepared me for this next stage in my life, which is to become a family nurse practitioner. Since working in the ICU, I've learned to communicate and collaborate effectively with others. I am a caregiver, an educator, and an advocator. All these roles are important in preparing me to become an advanced practice nurse. I am interested in nursing at Georgetown Family Nurse Practitioner program because it will allow me to be one step closer to meeting my career goals, which is to work with patients of all ages across the lifespan. Becoming a nurse practitioner will allow me to provide primary care with an emphasis on disease prevention to a wide variety of patients, especially in ethnicity and pathology. Georgetown University mission statement encourages students to be lifelong learners, and as a registered nurse, I feel it is of the utmost importance to continue our education. We should always try and stay current. I think my biggest challenge when entering graduate studies is being able to organize my workflow effectively. I know that the family nurse practitioner program is very challenging and will demand a lot of my time, so the best way to cope is to keep a very detailed schedule and always plan ahead. The clinical situation that best exemplifies my skills in leadership, advocacy, communication, and collaboration is when I had to take care of a patient that went into cardiac arrest. The patient suffered from a massive heart attack when I was in the room with him talking to his wife, and I immediately called the code blue and had to explain to his wife that a lot of people were going to be in the room performing a lot of interventions to try to save her husband. She was of course very scared, but she trusted us and said she'll be in the waiting room. As soon as I called the code blue, all the doctors, the nurses, and the respiratory therapists immediately came into the room and we started chest compressions. Since I was this patient's nurse, I had to communicate to my team what was going on, what his background information is. Once I started vasopressors, we were able to regain this patient's pulse and blood pressure. In the meantime, I had asked another nurse to go back out into the waiting room to update his wife about what was going on. Long story short, we were able to stabilize this patient enough to take him to the cardiac cath lab and place stents in his heart. This patient ended up surviving, and it was all thanks to everyone in the ICU for their teamwork and my split-second decision to call code blue. It was especially rewarding to hear the appreciation and gratitude from this patient and from his wife. Working in the ICU made me realize that I wanted to do a lot more for my patients. As a family nurse practitioner, I would be able to manage acute and chronic illnesses and provide care and follow up with my patients over a long period of time. I'm very grateful for all the learning experiences and the opportunity to care for others. I'm excited to start this next journey of my life with nursing at Georgetown, and I look forward to hearing back from you soon. Thank you.